Hello, and welcome to One World, One Health, where we take a look at some of the biggest problems facing our world. I'm Maggie Fox. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help address challenges such as infectious diseases, climate change, and pollution. A One Health approach recognizes that we're all in this together, and that everything on this planet, the animals, the plants, the people, the climate, and the environment, are linked. One of the greatest threats to humanity right now is the rise of drug-resistant microbes, bacteria, viruses, and other pathogens that can defy the effects of the medications used to fight them. It's known as antimicrobial resistance, or AMR. Doctors, public health officials, politicians, and researchers are all working to find ways to fight these germs. The United Nations is holding a meeting devoted to the problem. With all this going on, it's easy to forget how these infections affect people. Drug resistance kills millions, but it kills them one person at a time. One of those people was Mallory Smith of Los Angeles, California. Mallory was just 25 when she died in 2017 from an infection caused by a mutated version of a bacteria known as Burkholderia. Mallory had cystic fibrosis, a genetic disease that puts people at great risk of infections like the one that killed her. In this episode, we're hearing from Mallory's mother, Diane Shader Smith, who started an effort to gather the stories of people like Mallory. Diane, thank you for joining us.
My pleasure.
Diane, can you tell us a little bit about Mallory?
Well, she was extraordinary by all external measures. She was a straight-A student in high school. She was a 3-sport varsity athlete. She gave the speech at her graduation. She was the prom queen. She was beloved by all. Then she went on to Stanford. She studied human biology, and her specific interest was at the intersection between human and environmental health. While she was at Stanford, she played club volleyball. She decided that she wanted to change the world in a significant way and was hoping to do field research. But when her doctors told her that she couldn't, she wrote a book. It was a publication of the National Wildlife Federation called The Gottlieb Native Garden. And that was one of the ways that we came to understand how good and important her writing was. Another was that her professor at Stanford, who advised her senior thesis, Sue McConnell, said Mallory was one of the best writers she'd seen at Stanford in 20 years. So then she was off and running with her writing.
Wow, you must have been so very proud of her. I'm so profoundly sorry for your loss.
Well, she did that in between 67 hospitalizations, with each one ranging between weeks or months. So she was quite determined. I think when you have an understanding that your life might be cut short, it can provide an impetus to do what you want to do. And so she wrote for 10 years in her journal and kept it private. And that became the basis for the advocacy work that I do, using the messages that she left for me as my platform.
How old was Mallory when she was diagnosed with cystic fibrosis?
She was diagnosed at 3, and she actually was born with the disease, and there were symptoms, but many doctors missed it. And even after her doctors told me to terminate a 6-month pregnancy because of a cystic fibrosis diagnosis, I went back to her pediatrician and said, I think Mallory has it. The doctor said no, and then I took her to 5 other specialists, and all those doctors said, no, Mallory doesn't have it. And I said, I want to have her tested, and we found out she was. She was 3 at that point.
This is a disease that doesn't necessarily make kids sick all the time, but it does put them at risk of these infections that we're talking about.
Well, cystic fibrosis is like cancer in that there's all different manifestations. Some people get cancer diagnosis and it's a stage 0 and they have a procedure or they take medication and then it's gone. And some people die of cancer. And it's the same thing with CF. It's always been a life-altering, life-shortening, life-limiting disease before they had a new drug that actually now has extended lifespan for many of them. Most of the kids died young, but the age started at 5 and then went to 10 and 15, and the median age, I think, now is 40. So its lifespan is a lot longer now. But some people have a less serious case than others. And Mallory, because she was colonized by resistant bacteria, that changed the trajectory. That's when things got bad for her.
And you say colonized, what does that mean?
That means the bacteria takes up residence in your lungs and doesn't leave. So even though you use antibiotics to suppress and get rid of the bacterial cells, they remain inside of you. And so they're sort of pushed back and then they come up and they're pushed back and they come up. It's not really a case where you eradicate them. It's that they live there. And that's why they use the word colonized. And remember, I'm not a doctor. I'm not a scientist. I'm just a mom. So what I know from picking up things along the way, not from any formal study.
So because of her genetic condition, Mallory was taking antibiotics for many years.
Oh, yes. They start you on antibiotics immediately, and you inhale them when you're healthy. And you take pills until the pills stop working, and then you start with IVs. And then when one IV medication doesn't work, they layer on another. And sometimes the synergistic effect of different medications combined together provides some relief. And so eventually the bacteria outsmarted the antibiotics, as it often does. And Mallory succumbed to her disease. This happened after transplant when they had given her brand new pristine lungs, but the bacteria came back.
So she went through a lung transplant. That's traumatic in and of itself.
Yeah, it's a life-saving, but also catastrophic thing to go through. I watched her suffer in ways that were unimaginable to me before. Had I not seen it with my own eyes, I wouldn't believe how difficult it can be.
So when did you know that Mallory's infection was probably not going to be cured?
Well, when Mallory was officially labeled as colonized by Burkholderia cepacia, I think she was 12 at the time, her doctor told us the trajectory of her life had changed. And he explained that there were 3 paths for people that got cepacia. One of them was they get it and they die quickly. One of them is they get it and they have peaceful coexistence. And the other is they get it and they have about 10 years where the lung function just goes down and down and down. And because of the intervention and the wonderful medical care she got, she lived 13 years. So she surpassed the norm for people who fell into that category of it does kill you.
So she must have hated having to undergo all of this treatment.
Well, she grew up with the disease, and so she started doing treatment at the age of 3. And yes, she did hate it. And when she was 9, at one point she said she wasn't going to do it anymore. And we went through a period where she had a little bit of rebellion, but that's when we explained to her that her disease was fatal and that if she didn't do it, she wouldn't live long. She got used to it. She had a very happy life. She found love. She had friends. She went to Stanford. She wrote a book. It just kills me, though, that she didn't live to see Salt in My Soul or Diary of a Dying Girl get published, or the documentary, obviously, about her that came after she passed, because she would have been blown away by the impact that she has had.
And tell us about that, because she left behind a diary. You've mentioned that. She made it clear that she did want people to learn from her story.
Yes, in her life, there was a lot of her story that she didn't want shared because it was humiliating or uncomfortable and she didn't want to be pitied. She did write a blog for a while, and she did get feedback along the way from everyone who ever read her writing that she was a wonderful writer. And she did leave instructions for me in her journal to publish after her death. And so that's what I did. I started looking on the day of her memorial for things to say about her in her own words. And that's when I realized, oh, there's 2,500 pages here, and I need to do something with this.
Like in what way? Can you tell us a little bit about it?
Whenever her friends would come around and I would be in the room in the corner washing her gear, sterilizing her equipment, changing her bed, bringing her food, all the different things you do when you try to help a patient with a chronic illness so that they can live more in their real life. She would ask her friends about their lives and she would hear about their travels. And she always had a smile on her face and she always asked lots of questions. But in the journal, she wrote about how painful it was when people would come and talk about their camping trip, which she couldn't go on because there was no electricity, or pulling an all-nighter for a test that they had when that, if she did that, it would land her in the hospital.
So Mallory has left a legacy, and you're explaining to me how telling stories does help. And it's more than just raising awareness. You can raise money and you can make an actual difference.
Yes, well, I speak to medical students. Last week, I was at Harvard talking to first-year students on the first day because her insights as a patient are helping those who work in medicine understand patient care, ways that those serving in the medical field can do better and do more. We use her book to teach young people about antibiotic stewardship because we need to educate the next generation. As a matter of fact, Dr. Dominique Monet, who's the head of the European CDC, says that's one of the key responsibilities we have, is to teach the next generation about antibiotic stewardship, and most important, AMR in general, since really people don't understand. And what's happened by sharing her story, I've learned so much about AMR. And I'm often one of the only people in the room that is not a doctor, a researcher, a scientist, or someone who really truly understands. And then I'm able to see where the communication problems are, where the issues are that we need to explain to those not in the inner circle of AMR, because they really have no idea of what this crisis is, what it has done, what it will do, and why we need to care about it.
And now you started this Global AMR Diary. What do you hope to achieve with that?
So I started as Mallory's spokesperson. She had written for 10 years, and since she was not here to speak for herself, I felt I had to do it for her. And when the documentary came out, and in the trailer that the director Will Battersby put together, Mallory says, in her own words, it's her talking, "I've become resistant to the antibiotics." And people that work in the AMR space saw it and thought Mallory could be a good face to put to it, because we don't really have a face. Tom Hanks put a face to diabetes. Magic Johnson put a face to HIV and AIDS. Angelina Jolie put a face to BRCA, but we don't have an international spokesperson for AMR. So for 5 years, I was traveling the country and the world talking about salt in my soul. And it did really well. It educated doctors. I spoke to women's group. We taught antibiotic stewardship to young people. There were so many reasons, patient insights, over and under medicating, so many different issues, AMR, phage therapy. And I also learned that people who tell their stories get people to understand in a way that they don't by hearing statistics. So it occurred to me that the World Health Organization, the CDC, the Partnership to Fight Infectious Disease, many different groups were collecting patient stories, and they were putting them on their own websites, but they were sort of living in obscurity. And I had this thought that we should have a global AMR diary, and it gave me a reason to talk more about Mallory's diary in a different way, and that was important to me. So I approached the people I work with at the World Health Organization and the CDC and the ECDC and Bio and PFID and all these different groups. And everybody said yes. And actually, there's one man at the World Health Organization named Dr. Danilo Lofo Wong. I had given a talk to the European Commission, and I mentioned the idea of a global AMR diary about 6 months ago. And I said, I really want to do this. And afterwards, he just reached out to me through LinkedIn and he said, you should, and if I can help in any way. And he sort of gave me the impetus. He empowered me to take this initiative out. And then I went to Michael Craig, who works with the CDC, and I reached out to Jennifer Burke at the Partnership to Fight Infectious Disease, and all these different people that I've gotten to know along, and Emily Wheeler at Bio, people I've gotten to know along the way. And I said, can you help do this? And they all came together. And trust me, it is not an easy thing to bring together international global public health leaders and get them to agree on a press release, get them to agree on putting a quote in. And it's challenging because they have their protocols and their approvals, and no money was changing hands. And I had to make sure that it was very clear that nobody was profiting. So it was sort of a Herculean effort on everybody's part. And Dr. Dominique Monet at the ECDC, he was very supportive. And having those big organizations put their sort of stamp of approval on an idea is really why it happened. I mean, the idea of itself was really just to take the work that these other groups had done already and put them together and again, remarket them. I'm a marketing expert, so I understand the value in marketing. And the idea was to create this global diary. And I think the big difference for me is that I now understand, and everybody understands that works within AMR, that patient stories do make a difference. But it's more than just patient stories. It's the caregiver stories, people like me, who've had the losses. It's the medical providers who are trying to save the lives of their patients who have resistant bacteria. We need to hear their stories and the impact and the toll it takes on them. And then the biotech innovators, the people who are actually moving the needle in terms of what they're doing to try to find solutions, because it's not easy.
Diane, that is some story. And boy, you must still be so proud of Mallory. Thank you for joining us, and thank you for sharing your story and Mallory's story.
Oh, it's my pleasure. Thank you.
Listeners, if you enjoyed this podcast, please share it. You can find links to the books and websites we mentioned and find out more about other important topics at onehealthtrust.org. And let us know what else you'd like to hear about at OWOH@onehealthtrust.org. Thanks for joining us.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.